Yes,
Hello.
okay. Yes,
Hi,
hello
hi
everyone.
again.
Hello, good afternoon.
Hello.
Us three again. Mr. Ben.
Yes, I'm
Hello,
Welcome.
back.
hello.
Last week, someone asking for me.
If
Everyone
you're here
asking for
already, yeah. I think Mr. Ben very popular lah. Everyone asking for you.
Good lah, good sign. No lah, you can get
So I
tips
see,
ma. Those who follow up us, you can get tips ma from our
I
presentation.
see. Correct. I see a
Yes,
few
yes.
eyeballs now. So
Yeah,
if you're
yeah.
here already, give us a +1, give us a like, give us a heart. Let us know you're here. Okay.
Yes. Yes. And today same thing, we have free gifts to be given away.
Free gift. Whoa.
every time there's a gift to our audience. And what
Yes,
is it?
Yes.
It's a gel, right? It's a
it's a gel. It's a Perskindo gel.
indoor gel
Yes, yes,
for
Mm.
pain relief,
yes.
and you're
Okay.
putting it.
That one Perskindo gel, actually, we will create another video on that as well. Yeah, we will
Oh,
create another
wow.
video on that. Yeah, because we under some request from the Perskindo company, so we will create a video on that which specifically tell us how to utilize the Perskindo gel.
Oh, okay. Okay,
Yes,
sure.
yes.
Think that'll be quite interesting also. Because I thought
Yeah,
like
in a way,
gel
yeah.
just apply, but
Yes,
maybe there are certain ways to apply properly.
yes.
So we have to find out soon.
Yep. I think I saw new names today. Jessica Chalk.
Hi,
Hello.
Oh,
thanks for joining us.
yes. Hello. So
Hello,
do
welcome to today's
comment
live.
plus
Yep.
one if you
That's
are
one.
watching
Give us
us.
love.
Okay.
Give us some love.
Yes.
So, Mr. Ben, today, Mr.
Give
Ben,
10 love.
today, Mr. Ben talking about
Yes.
carpal tunnel syndrome. It's a very
Yes.
common
Very common.
Common.
symptom.
Yep.
Sometimes
Yes.
they say, I think I have carpal tunnel syndrome. But is it carpal tunnel syndrome?
Yep.
Yep.
So, and also we will talk about how we treat it, how to assess, and then how to treat it. Yeah.
Mm-hmm.
Okay. Shall we start?
All right, sure.
Okay.
Okay, so yeah, so that's why today we try to make our topics a little bit more catchy lah. So without surgery, can a physio undo your carpal tunnel? Okay, as everyone know, right, carpal tunnel means the tunnel is closing, correct not? And it's compressing on the nerve.
Yes.
Yeah, so therefore we come up with this and how we undo the closing tunnel. You imagine if the tunnel already closed now, how to undo it?
Close
Put a
like that.
bomb, we put a bomb there. Yeah. Yes. Okay,
Flat.
but wrist cannot, right? You cannot bloat your wrist, isn't
Blood.
it? Can bloat your wrist, right?
Yep. Hiya. Mr. Ben?
Think Mr. Ben is a bit laggy also today.
Yeah. Apologize again.
And once again, thank you for being here or being our supporter, following us, watching our FB live. It really means a lot, okay, to
Yes.
see all of you continue watching us. And it gives us that motivation to continue as well.
And it's also a lot of hard work actually to compile this research and vomit out the facts, gather the facts.
Not vomit lah. So it's I think the team has done a lot of research prior to preparing. So a lot of background work has been done to prepare all these slides. A lot of hard work lah. Hello. I see a lot of names here saying hi. Hello. So just wait for a while more, yeah. Oh yeah. Don't forget to help us share this live and tag 3 friends. All right.
Hey, sorry. I think the line will.
And Mr. Ben. Hello.
Hello, yeah, sorry. Okay, so shall we proceed?
Sure.
Okay.
Yep. Okay, so we are talking about inflammation of the body. Okay, and there are two types of inflammation. One is acute inflamed, one is chronic inflamed. So again, we are talking about acute inflamed. Acute means what? It happens now. All right, recently. Okay, and some of you may have the carpal tunnel for 6 months, 1 year. All right, we still call it acute, but it's just like maybe the acute inflammation in chronic. Okay, but we still call it acute because now you're still having the numbness, everything. Okay, so today we're going to talk about carpal tunnel syndrome. All right, now, just let's analyze the word first, carpal tunnel syndrome. So carpal means what? Carpal. Okay, so carpal actually means our two rows of our bones around our wrist. Okay, this is what I call carpal bones.
Yes.
All right, tunnel means, all right, the tunnel means these two rows of the bone, right? So it's formed a tunnel. It forms a tunnel, and that's where all our muscles, tendon, and nerve pass by. All the wiring pass by the tunnel. All right. So carpal tunnel happens when this tunnel collapse or closing, and it compress onto your nerve. Yeah. Okay.
So it's like flattening, yeah.
Yes. You may not call it flattening. It's a compressing lah. It's a compressing.
Compressor.
All right. Yeah. Some people fall. So after a fall, they have this syndrome, carpal tunnel syndrome, also possible. All right. Okay. So next, let's talk about the myth. Okay, or the wrong concept. Yeah. Okay. Now, normally, because we have seen many cases, right? Their main complaint is they feel hand numbness. Okay, and a lot of practitioners will straight away diagnose them as a carpal tunnel syndrome. Hand numbness. Numb means what? Numb means tingle, ends crawling. Yeah, or some people feel a little bit heavy, stiff. Okay, so actually it's not very, very, very accurate or precise. Okay, now over here I give a few different type of complaint, right, that we usually receive from our patients. Now, number one is I got hand numbness. Okay, another one I got morning numbness. Okay, and one more is every morning I feel my hand stiffness. So actually all these three kind of complaint, it looks the same, isn't it? Correct or not? It's the same one.
Same
hand numb,
different.
morning numb, or my hand morning stiff. Same one, right? But actually, I tell you, the trick is they are different. Okay? Now, some numbness is talking about carpal tunnel. Some numbness is talking about from neck. It's a compression at your neck. All right? So that's why today we are here. We try to explain to everyone how to distinguish it. All right? All right. So over here, we use the word peripheral nerve and distal or the distal nerve. Peripheral means the further the nerve is lah. Okay, or it's a nerve near the, or another possible is the nerve near the neck area. Okay.
Mr. Ben, I think someone just asked what's the subject today. So today Mr. Ben is talking about carpal tunnel syndrome. Okay.
Yep. Okay.
Yep, carpal tunnel syndrome.
Yep.
Okay.
Okay. So next, before I just a quick share. All right, now there is one study did, which is named the double crush in the nerve entrapment syndrome. Okay, so out of this study, right, so they have 115 patients with hand numbness. Okay, 81 of them have evidence of cervical root lesion, that means neck problem. Okay, so again, hand numbness does not mean it is carpal tunnel syndrome. Hand numbness also can be because of neck problem. Okay. So, and again, another study also, 32.5% of the carpal tunnel, confirmed carpal tunnel, has cervical spine. So again, this is the myth. My hand numb, is it carpal tunnel? Not necessary. Okay, it could be your neck problem. Okay. So next, I have another journal.
You meant to say that the carpal tunnel is just a symptoms, is it?
Symptoms, yeah. It may not appear carpal tunnel.
So we have to find out where is the real culprit.
Yes, is it carpal tunnel only? That's why some people after treated for 6 months, a year, carpal tunnel still there.
Still there.
Why?
Yeah.
Because you treat wrong part. The wiring, you are on the right wire, but you treat the wrong part.
But different, yeah.
Okay, that's why everyone is here today, Yes. Okay. So next, I also showed another study. Another study we talk about the prevalence of carpal tunnel in the general population. This one is 1999 study. Okay, so again, they study a general population with hand pain, numbness, and tingle in the hands, right? Now again, from the study itself, right, only 20%, okay, who have hand numbness and tingle, they are diagnosed as carpal tunnel syndrome. That means what? 80% hand numbness is
not
carpal tunnel syndrome.
Not
Okay.
really from the carpal tunnel.
Yes. Okay. It's very cool actually. It's very cool. All right, because this is a very common misdiagnosis, we call it. All right. Now another study. So this one study, you will ask me, Ben, all this study not local one. So now I give you one Malaysia one, 2019, just last year. Not I do lah, someone did. Okay. So they found out 80% of female. Okay, 80% of female has carpal tunnel. Cute, very cute. Okay. Okay. Yep. And of course, it goes with your high BMI and the age lah. So as your age goes more, it become more worse. But you see, question, if you can do something and you understand it at your young age, you can prevent it. Okay, or you can even delay the onset. All right, delay the onset means what? Initially, age of 40 you kena. Maybe now age of 60 or 70 only you kena. Something can be done. Okay, this is what I assure. Something can be done. All right, and then about 34% are housewives. So if you are female plus you are housewife, your percentage even a lot more higher. Okay, and then 21% are clerk. Okay, 17% are teachers. Okay, and then 8% are healthcare. So all these are using their hands a lot more. Okay, like the clerical, right? Use a lot of keyboard and the mouse. Later we'll talk about a little bit about mouse. Yes. All right, and one more thing, very weird. Carpal tunnel syndromes happen on 82% with a dominant hand. That means that if I'm a right hand dominant, carpal tunnel will happen on my right hand, 82% higher. Okay? So again, if carpal tunnel happens on my non-dominant hand, is it a carpal tunnel? It's another question mark. Okay? Wow.
Then we have to check again.
Check again, yes. So that's why I always say so. The whole idea, the whole message on this is, if you're having carpal tunnel, that's where you are. This is the slide. This is the presentation that you should listen to, because we just want to make sure that are you treating the right place or not? Are you treating the right root cause or not? Okay, that's why our sharing is like that. It's meant for it.
Okay, so if you know of anyone who has symptoms like that, they think they are having carpal tunnel numbness over here, but after this presentation, you will learn that maybe it is not coming from here. Do tag them or share this.
Yes.
Help us share.
Yes. Okay. So next slide. So my next slide is talking about possible causes of hand numbness. I tell you, there are many causes. Okay. Around here is about 8 causes. All right. So, but we are going to discuss about 2 only: carpal tunnel syndrome and something called median nerve. Because these 2 almost has the same symptoms. Just like I said, morning stiff, and then morning numbness. Okay, what are their difference? Okay, so today we're going to talk about 2 things only: carpal tunnel numbness, carpal tunnel syndrome, and median nerve. Okay, and don't forget those who have a poor or very bad diabetes. All right, they may also have hand numbness. But of course, this is very rare. This one is very rare, but possible. Okay. Yep. All right. So now the next slide we'll be talking about how to distinguish. Actually, also not easier to distinguish actually. Okay. Now, if you are having a carpal tunnel, right now, if you look at the column at the bottom, in the middle, finger numbness one. Okay. Now, when we talk about finger numbness, right, normally we are referring to these 3 fingers. All right, these 3 fingers, 3 or 3.5. Half is around here. We call it 3.5 finger. Okay, if your numbness is this 3.5 finger, most likely it's a carpal tunnel. Okay, because compression. So therefore, your compression of the nerve here. Therefore, you have the symptoms around these fingers. 3.5. Remember this. This is a word. 3.5 fingers. Okay. Remember this. This is the answer. Remember this. This is the answer. Okay. So I already give hint 3 times. Important hint I give 3 times. Okay. So now carpal tunnel syndrome, right? Because it's an inflammation around the tunnel. So as you're working, as you're doing activities, right, your numbness become more. Okay? Now, unlike another morning numbness, the next column, the morning numbness normally you can tell is a 5 fingers. Okay? And after activities, the fingers becomes looser. This is the biggest difference between carpal tunnel and non-carpal tunnel. Clear? Okay? Carpal tunnel, 3.5 fingers. And after activities, it becomes worse. 3.5. After activities, it becomes worse. Morning stiffness, morning numbness, normally are 5 fingers, and after activities, become better. Okay? So therefore, right, those who have carpal tunnel, after a rest, they feel better. Just more activities make it more. That's why housewife, the more they do, the more they feel tingling, the numb. If a carpal tunnel. That's why rest, they feel better. But if a morning stiffness, rest does not help. In fact, move more, you feel better. Okay, this is the biggest difference. Okay, now the number 4 point, we call it ULTT. ULTT is a test which we're going to discuss after this. No, not today, Thursday. Stay tuned for Thursday. Okay, ULTT is a nerve test that everyone can do at home. Okay, it's to test whether are you confirmed carpal tunnel or non-carpal tunnel. All right, and then today we'll talk about Tinel test and Fallon test. Okay, and also we'll talk about the nerve conduction test. So if you look at the bottom 3, right, it's a very, very gray one. All right, it can be maybe positive, maybe negative. But the first 3 is the confirmed symptoms. All right, to help you to distinguish is it a real carpal tunnel or non-real carpal tunnel syndrome. Okay? So remember, 3.5 fingers. Okay, you want me to repeat 3 times? 3.5 fingers.
3.5.
Thank you, Ken, for repeat 3 times. So in our opinion, how we treat carpal tunnel? Now, someone will ask me, hey, Ben, how come you all never tell us what is carpal tunnel syndrome? How does it look like? So everyone, look it this way. Dr. Google will tell you more than what I can tell you, right? Okay, so today we're not going to tell you carpal tunnel, how does it look like? No. We will tell you what BENPHYSIO can do and what is our belief. Okay, so now next slide is talking about what can BENPHYSIO do. BENPHYSIO's belief and how BENPHYSIO explains carpal tunnel. Okay, now to treat carpal tunnel, all right, in BENPHYSIO, we believe that carpal tunnel is not only because of your tunnel. Okay, it's not because of tunnel and then we will do something to bloat your tunnel. No. All right, carpal tunnel is due to your entire forearm muscle usage and your thumb. Okay, thumb play a very important role. Yeah, okay, the entire forearm as well as your thumb. Okay, so now we believe everyone do house chores every day. If you involve in a lot of daily activities like house chores, yes, you have high tendency to get carpal tunnel.
I think now with MCO even more.
Yes, because everyone's free at home, right? Baking, kneading bread, baking the egg, cooking. Yes, okay, and 82% is on your dominant hand. So if you have your female, dominant hand on your right, and your right hand got 3.5 fingers numb, most likely, very high possibility.
3.5.
Okay? Yes, 3.5. So second factor is repetitive wrist movement. Again, it's a lot of those houseworks, okay, repetitive wrist movement. And then sudden heavy lifting. Okay, why we use the word sudden heavy lifting? Now, give an example. Now, MCO, you cannot go shopping every day, right? Maybe 1 month, you only shop 1 time, right? So if
once
I like handbags, so once a week, okay. So I like handbags. Previously, I buy handbags every day. So now I have to buy handbags, 7 handbags in 1 day. So what happened? I go home with 7 handbags. So it's a sudden heavy lift. This is called sudden heavy lift. Okay? Yeah. I still want to buy 7 handbags, okay? Yeah. You see? So this is what we call sudden heavy lift. Now suddenly you increase the loading on your forearm muscle to hold something. All right? And then forceful pronation and supination of the forearm.
I think the sudden heavy lifting also applies to the gym.
Yes. Yes. Too hard working. Normally you carry 5 kilo, very good, Shu Hui. Yeah, you pointed it out. Normally you carry 5 kilo. Suddenly today, I'm very shocked. I feel very I want to go 50 kilo.
Very heavy.
Yeah, something like this. Yeah, this is what I call sudden. It's not your normal pattern, and you suddenly increase your pattern. increase or change your pattern. Yes. And then forceful pronation and supination. Okay. So whereby you suddenly have to over twist your, okay, this one. Now, do you know, again, during MCO, everyone buy cupboard, right, from Shopee. So you buy cupboard at fixed cupboard, right? So you have to undo and screw. Yeah. So all this can cause a sudden onset. We call it sudden onset of a carpal tunnel because it can be a forceful, it can be a repetitive pronation, supination of the forearm, whereby all twisting like this. Yes. All right. And then strong grip of pen steering. All right. When you grip too hard on the steering or pen, also can cause all this. All right. Rackets, okay, loose grip of the rackets, golf club. Okay, because when your grip is loose, right, so you have a tendency to hold tighter. You scared your racket fly away. But have you all experienced before when you play badminton, right? Play, my racket fly away to the next court.
God.
Right.
So you're very embarrassing.
Yeah, supposed to be a soccer court fly, right? How come your racket fly? Okay, so loose grip. So therefore, what will you do, Ken? You will go hold harder. Right? You will hold harder. So all this will contribute. And you see, all this contribution is an indirect contribution. It's not a straightforward, but it is. It is. Yes. All right. And number 7, mouse. Mouse. Which mouse?
Mouse.
Not the mouse. Not the one.
Mouse.
Yeah. Okay. The computer mouse.
Mouse.
Now let me check on two of you. Which kind of size of a mouse, small or big, can lead to carpal tunnel worse?
I think the small one.
Yes.
Small.
Okay. Small one. Why? Small mouse, you have to grip more harder.
Because you have to grip more.
Yes. Bigger mouse, you can grip it more relaxed.
More relaxed.
Yes. So after this slide, what kind of mouse you want to buy? Big one or small one?
Big
Big
one.
mouse.
Okay, more comfortable. Be lenient to your arm. More comfortable. All right. And lastly is a power grip of thumb. All right. Actually, just how you say, right, forearm muscles and then thumb muscle. And everyone knows thumb muscle is a very important digit in our arm. Correct or not? Every movement is from thumb. Without your thumb, your 4 fingers may not function perfectly. Yeah. Okay. So power grip of thumb, make your thumb muscles tighten. It also can lead to carpal tunnel. Yes. Okay. So far, any question? So again, what cause carpal tunnel? The message is very simple. Your forearm and your thumb muscle. 2, forearm and your thumb muscle. All right.
So to conclude all these activities, right, the factors is mostly due to the gripping, right?
Yes, gripping, a lot of gripping, usage. Yeah. Okay. Yep. Oh, a lot of forearm usage. Yes.
Alfonso said her bowl, my bowl during bowling always fly away. Wow, that is very dangerous.
Yeah,
Then I think need to look for suitable weight.
Yeah, maybe. Or your finger patah inside there. Hey, how come the ball goes my finger is there? Okay?
Okay.
Yep. Okay, so next slide, we give everyone a visual. So now when there's a lot of gripping work happen in your daily activity, okay, all your muscles will contract. Contract means shorten. All your muscles will contract. All right, and therefore it will close your tunnel. All right, so therefore it will close your tunnel. Okay, so if you can see here, all right here. So when all your muscles are contracting, this tunnel will slowly close. So same thing, if I hold a small mouse, the tunnel will also close relatively. Okay, so that's why we say a lot of grip problems, the tunnel will close. So what to open? We will need to stretch these muscles and also unlock. We have to learn how to unlock the tunnel. After this, we will have a small short demo on how BENPHYSIO work on your tunnel to unlock or undo your tunnel physically. Yes, physically, without using any bomb. Yeah, we don't use bomb.
Don't need to bomb.
Yeah, all right. Okay. And median nerve is a nerve that gives us 3.5 fingers. Median nerve. Okay. Yep. All right. So so everyone quite clear how with the symptoms and the reason. So of course, when we go to see our doctor, normally doctor will use this apparatus to check on us. We call it nerve conduction test. All right, and no doubt, the test is very, very relatively very highly reliable. Okay, But again, it still can't tell you, okay? Because when we talk about median nerve, it's not only median nerve here. From our neck comes up also, we call it a median nerve. All right, so we have to know where, okay? Either it's a proximal or a distal nerve. All right, so these are tests. Okay, we're not going to talk a lot on this. All right, okay, next. There, this is how physio check on you. So whoever comes carpal tunnel, this is what we will do on you. Okay, now there are 3 tests here actually. Okay, there are 3 tests here. Now myself personally, I like TNL test. Okay, I myself personally, I like TNL test, which is a 68% sensitivity high. Okay, TNL test is something like this. So if you look at the picture with the right background, TNL test is like this. You know already, right? Carpal tunnel is here.
Yeah.
Okay, now to be exact, where is the tunnel? There's a sulcus here, and you see, there's a line here, isn't it? There's a line here, and there's a sulcus
depression over here.
Yeah, that's a depression. Now that's where your median nerve and tunnel is. Okay. Now if you're at home, you can try it yourself. What do? You use your opposite hand. Right? Opposite hand. You try to tap on the tunnel. Tap on the depression. Okay. One, very tap on it, and see whether you can feel zig into your fingers or not. So this is what we call TNL test. Normally, if you come, physio will do tap on you. If you can stimulate or reproduce a electrical feeling, so it is tested positive. Okay, so second test we call it Fallon test. Fallon test is like the purple bikini lady. She is doing there. So what you do is you just put your wrist in this angle. Yeah, and as an instruction, you hold it for 30 seconds. Okay, hold it for 30 seconds and see if you can have some tingle or some shock. Okay, but it's actually my personal experience that Fallon test not as sensitive because some people 30 seconds are normal. They may require longer time. Yeah, they may require longer time. Also, I still prefer tap TNL test to tap on the wrist. Yeah, straightforward. Right now, apparently, according to research, the test is higher sensitivity 77.6. Now, this one can be done very simple by putting your thumb on the depression point just now. On your depression point. All right, and then stay for about a minute. Okay, the contest.
So it's like compressing it.
Yeah, just compressing it on the nerve as well. But again, personally, I feel like it's also not as sensitive as TNL test. Maybe my favorite is I like to do TNL test. All right, TNL test is tap. The contest is I just press on there for about 1 minute. Right, again, all we are trying to look at is does it reproduce your 3 fingers number or not? If yes, positive, congratulations, confirm carpal tunnel syndrome. Okay, congratulations because confirm it is carpal tunnel. And you are on the right topic today. Okay.
But I think the easiest test for people who is non-related to physio one, I think is the Fallon.
Yep, perhaps Fallon or the test. Yes. Anyway, you can try all these 3. You do no harm to yourself. Yes, okay. And you should feel happy if you can reproduce it. Okay, because at least you know, I got this problem now. I confirm already. Yeah. Okay?
They have to get it fixed.
High sensitivity. Yes. Okay. Otherwise, you have to go to hospital and do the electrical test already. Yeah. Okay. So now
you try to test everyone. So you just try to test. If tell us in the comment if you have any numbness.
Yeah. Okay. Then we will send you our phone number so that you can make an appointment with us. Yes. Okay, so these are the tests that we normally physio will perform on our patients. Yeah, okay, and it's the accuracy is very high, more than 60%, 68%, 77%. It's very high reliability. Yeah, it's a trusted test. Very good. Okay. Yes. So now we know carpal tunnel. We know physio can undo it, but Ben hasn't shown it yet. Ben hasn't shown it yet, but we know how to test on it. We know what are the symptoms. Okay. So let's see how to check. Okay, so now we talked about the forearm tightness, right? So now how to check the forearm tightness? How to check? All right, we know already. I got carpal tunnel confirmed. So now next, how to check? All right. So now how to check your wrist or forearm muscles. Very simple, like the photo. Just extend your wrist downward. Okay. Now if you feel very stiff at your forearm, Don't worry, confirm your forearm muscles are tight. Okay, now secret or some hints. If you're dominant on your right hand, normally this test is also positive one. You will feel quite pulling one. All right. So therefore, even though you have no carpal tunnel, but when you do this test, you feel it. Just do it as an exercise for yourself. Okay, you get what I mean? Oh, okay, because it's good anyway. Just how we say, 82% of dominant will have carpal tunnel. So do it prevention. Okay. Now another way to test your forearm is supinate. Turn your hand to the max. Okay, you can compare both hands. See, my right hand cannot turn as much. That is already.
Slightly,
okay.
Slightly.
Slight. Yeah, so slight that means a little bit tightness there, a little bit tight on the forearm. Yes, a little bit. But all this a little bit. Sikit-sikit jadi bukit lah. Sikit-sikit jadi bukit. Will give you more compression in future. Yeah.
Yeah, Mr. Ben.
Yes.
So Mr. Ben, yes. Comment Jessica been asking. So the numbness, should it be the 3.5 fingers?
Okay. Normally, yes, it should be a 3.5 fingers or at least 3 fingers. Half a bit difficult to feel.
3.5.
3.5, but half a bit difficult to feel. The half means here. Okay, normally people will feel this 3, or some people feel this 2, also considered as. Yeah. All right. Now, if you ask me, how about this 3? This 3 considered or not? This 3 considered or not? No, this is not carpal tunnel. No. Okay, carpal tunnel must start with the thumb, index finger, and your middle finger. Okay. So if only middle finger possible, yes. Okay, middle finger possible. Okay, you still can call it carpal tunnel. It's still potentially carpal tunnel. Yes. Okay. Yeah. Okay. Okay. So how to check your forearm? Now we know. Either extend your forearm or you can twist your arm to the max. If you feel it, then yes. Okay. So I think she also asked, what if 5 fingertips?
Yes.
Okay. If 5 fingertips, the answer is the neck. Yeah. Or if all the 5 fingertips, this one fall under the category of morning stiffness. It's a 5 fingers morning stiffness. Actually, yeah. You are right. It's a neck problem. Okay. Today we're not going to present this about these 5 fingers tips. It will be the next coming Thursday. Because today we will talk about carpal tunnel first. Coming Thursday we'll talk about the 5 fingertips. Yes.
This Thursday.
Yeah, this Thursday.
So stay tuned.
So now, So now after checking all this, so just now we said thumb also possible, right? Now how to check your thumb? Okay. So thumb very simple. This is your thumb. You just try to pull your thumb down. All right. If you feel a lot of pulling in your thumb, then yes, your thumb also very tight. Thumb is also quite flexible. Yeah. Okay. For some people, right, when they show thumb, the thumb is like this one. Can see the difference. Can you see the difference from the video? Some people's their thumb is not open one, wrong. Their thumb is a little bit like this one.
I think mine got a bit.
Okay. So this is also a thumb tightness problem. All right. Yes. Okay. So thumb is a very important muscle in this topic today. Okay, because thumb is a very important muscle to do, especially to perform a power grip. Yes. A guitar player always hold the clip one. Yes. So the guitar player easily have right thumb and left forearm tightness. Because left forearm keep on playing.
Yes.
Okay. Drummers, they sometimes get the right. So their hand they have to hold very tight.
Hold harder.
Yes, hold harder. So all these are violin also. Violin. Yes. So all these are the daily activities. We don't stop you from doing your favorite. Okay, but we help you to how to play or deal with your favorite. Okay, with a potential problem. Okay. So next, the last part. Okay, we talk about treatment. Okay, now treatment, of course, we will touch about how we treat from physio. Medication wise, we won't touch much. Injection, okay, or surgical. All right. Okay, next slide. Okay, so to compare. Okay, conventional, our physio approach will be direct treatment onto the median nerve. Just now we say, the nerve that compress here, we call it median nerve. All lot of people will do a direct treatment of hardness. Okay, and then secondly, conventionally, people will give you exercise your
Strengthen.
muscles. Yes, to strengthen your muscles. Okay, I will give you a gym ball. A lot of people always ask me, "Hey Ben, so I got carpal tunnel. Can I squeeze the ball?"
Squeeze.
I tell you, yeah, you squeeze the ball, you come and see Ben. Okay, don't squeeze the ball.
Then stay longer.
Yes, stay longer. Yes, okay, don't squeeze the ball. This is very traditional. This is a very traditional physio treatment. Yeah, so overband physio normally don't. Yeah, it's a no. It's a no. Okay?
No.
So normally, we will rather help you to loosen your flexor muscle. Flexor means forearm muscles. We will help you to loosen your forearm muscle, help you to loosen your thumb muscle. Yes, okay. So if anyone, if you used to come across treatment to ask you to squeeze ball one, please stop it now. Who says? Then physio say. Okay, stop it now. Okay, because this is not the direction. All right. Okay. So next. So if that case, how to help myself? Now I will ask first question lah. Okay. On day one carpal tunnel, can I see physio? Answer is yes, no. Always. Nowadays, physio has come to a point that you can see us during the first day or day one. Okay, because day one, if you found that there is inflammation, acute inflammation, we will treat your inflammation first. Or via rest, ice pack, decompression, support. We give you ultrasound. We ask you to get solumeric. Or we even ask you to get medication, anti-inflammatory medication. These are what a physio will advise you on the day one treatment. Okay, and next. Okay, then that's where you come for band physio, and we will do something different. Okay, something extra. Okay, of course, as usual, we will loosen your muscles, forearm muscles. Okay, as usual, we will loosen your forearm muscles, and then we also will loosen your thumb muscles. Loosen means make the tightness a bit loose. All right, so that it don't continue.
And loosen a bit.
Okay. So, and then how band physio open your tunnel? Yeah, that's where our demo is. Okay, so I think now I'm going to show the demo. Wait, let me get my demo hand. She will show me the demo hand already.
Okay.
Okay. Wait, let me adjust the angle.
Nice hand.
Yeah. Okay, this is the one. Okay. So now normally what we do, yes, we will loosen the muscles. We will loosen your muscles around here. This is, can you see the muscle side? The muscles about here?
That looks very tight.
Yeah, very, very tight. You can see, right? And then also we will also loosen the muscles here. That's why if this is positive one. You see, very tight. So same thing, I twist the arm. Okay, this one not too bad. But this is very, very tight. You can see all the muscle shape coming out already. Very stiff muscle, forearm muscle. All right, so this potentially also will have carpal tunnel. Okay, now we also will look into her thumb muscle. See her thumb? See, cannot open one. Okay, in rest, the thumb is closed one. So in rest, you see my thumb? Wait, you see my thumb? And you see her thumb? Her thumb cannot open one. Okay, because her thumb muscles are very, very stiff. All right, so therefore, in this case, if she come and see us, we also will treat her thumb muscle. Okay, if I show you her face, right, she is now jerit already. Okay, so we will loosen your forearm, we also loosen your thumb. Now, next, the exciting part, how to unlock your tunnel. This is a tunnel, right? Now, normally what we do is, we will try to unlock your tunnel by doing this. Okay, I do it this way. We will unlock your tunnel by doing this. Because we know the bones is here. Okay, the bones. So we will pull the bone and split them out. This is how we open up your tunnel unsurgically, without surgical. Okay, and how it works? Yes, it works. Guarantee works. But of course, you don't tell me every day you are just doing this, it won't work. Okay, you have to loosen the muscles. You have to loosen the muscles. You have to loosen the muscles. Then only you go and open the tunnel. Correct or not? You have to unlock the screw first, isn't it? The screw is here, the screw is here, the screw is here. Then only I can open up the tunnel. Yeah.
A lot of different screws.
Yes. Three screws, three big screws there. Yes. Okay. So I throw the hand
I
away.
think someone just commented, Vivian just commented, her thumb always cramp.
Yep. So come out. Thumb cramp. That's another problem.
Oh.
Okay. Yep. That's another problem. Thumb cramp. Okay. Overuse already of the thumb muscle. Overuse. Yes. Okay. So she
need to seek treatment.
Yeah, her activities again. I think she's a healthcare provider.
Yeah,
So just now we were saying 8% of healthcare providers will always have carpal tunnel. 8%, and someone she is female, so she fall under the same category. And it happens on her dominant hand, same thing. 80% times another 10%. Yes, very high possibility.
High risk.
Yeah, very high risk. She is very high risk.
Yeah,
Okay.
I think she
Miss
needs
Vivian, I think.
releasing.
Yeah. Okay. Call us, make appointment.
Yeah.
All right. So make appointment. So actually, because BENPHYSIO, we do a lot of manual therapy, loosen the muscles, and it's a lot more effective, fast and effective. Effective in the way immediately you can see the difference. Yes. All right.
Like
done.
magic.
Yes. So that's how we open your tunnel. So today is an exclusive live demo. Okay. So next is self-help at home. So what can you do at home besides asking someone to help you to open up your tunnel? Now, 2 things to do. Okay, number 1, find a way to loosen your forearm, and number 2, find a way to loosen your thumb. Okay, to do it very, 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 very simple. Okay, what you need to do is just pull your palms downward. Pull your palms downward. That's all. All right, just pull it down. Hold it for 10-15 seconds. Hold it for 10-15 seconds. Just pull it down. That's all. Okay. Some people may ask, correct or not? Hey, can I do like this? I pull it upward. I say can, but try again. Pull it down. The feeling is different, man. You feel a lot more. You will feel a lot more when you do.
Yeah. Feel a lot.
Yeah, you feel a lot more. Okay. So this is how you loosen your wrist. Okay. Now you see, if you read properly, right? What I wrote there, wrist loosening every time after workout. Okay, so over here, right, my workout means what? Anything. If you carry 7 handbags today, it's considered as a workout. Do your stretching. If you do housework today, do your stretching. If you cook Maggi mee today, do your stretching. After your mouse usage, do your stretching. This is what I mean every time. This is how you protect your own body. Yeah. What is health?
Maintain.
What is health? Okay, health is how you find the answer. This is how you protect your body, protect your property, okay, in your body. Yes, okay. And second one is thumb loosening. Just now we have 4 fingers, right? Now how about thumb? Same position, just pull the thumb down. That's all. Yes, same position, just pull the thumb down.
The elbow is straight, right?
Yes. Now the wrist are straight.
The elbow has to be straight, right?
Yes, elbow have to be straight. Okay, maximum pull. Okay. That's all for my self-help. That's all, very simple one. Okay, so at least I think today we tell everyone how to distinguish carpal tunnel and non-carpal tunnel. And then the message is who is a culprit, which is the forearm and the thumb. All right, and how we can unlock your tunnel without surgical. All right, and it's doable. It is doable, confirmed. Okay, and so yes, so just now someone is asking about the 5 digits numbness, right? So stay tuned. Thursday, we will talk about it on Thursday. Yes.
Thursday.
Yeah,
yes.
Mr. Ben.
Yeah.
We forget about the most important part.
Yes, the question, ma.
Yeah.
Everyone know the answer.
Everyone is waiting.
Okay. The question is, if carpal tunnel, which fingers will appear with numbness? Okay. If carpal tunnel syndrome, which fingers, okay, or how many fingers will appear with the numbness? Okay. Answer, find yourself. Yeah. Okay. 3.
I think I mentioned the answer just now.
Yeah. 3, not very correct. Okay. Have to plus a little bit more. Yes.
Little bit.
Yes. Okay. So that is the answer for today. And today, what we're giving away, Shu Hui?
We are giving the Preskindo gel.
Preskindo gel, yes. Okay. And this Preskindo gel actually is a blue color Preskindo gel, same like our uniform, blue color Preskindo gel. Okay. So a video on this Perskindo gel as well.
So briefly, it's about it's for cooling effect and pain relief, right?
Yes, it's a for cooling effect. For cooling effect, or especially after workout or after some sports. All right, yeah. So you can use the Perskindo gel for soreness. Yes.
For relief.
Yes, for some simple relief, I call it simple relief. Okay, I think I saw someone replied first 2.5 fingers.
2.5.
Okay, your answer.
Are you sure?
Yeah.
Try again. Don't give up.
You
Try
have to
again.
or maybe he give us +1 already, so he only have 2.5. Yeah, okay, you have to +1.
Two points.
Yeah. So
actually, the first one actually correct already one, but I think you need to tag 3 friends.
Tag.
Yes.
tag
3 friends. Tag 3 friends.
Okay, and today we'll talk about carpal tunnel, and for those who interested with our slides, right? You can also comment slides, isn't it, Shu Hui?
Comment
You
slide.
can comment slides. We will send you the slide. If
Mhm.
you miss our live, you also can go to our website or our YouTube, all right, to trace back the live.
Yep.
Yeah.
Type BENPHYSIO, you can find us.
Yes. Okay.
Okay, I think that
So
for
see you
today.
all again on this coming Thursday.
So once again, okay. Once again, thank you very much, Mr. Ben, for today's sharing. About how we can unlock the carpal tunnel syndrome without surgery. So stay tuned for part 2. Part 2.
Yes, it will be more interesting part 2. We also have live demo.
Yep.
We also have live demo.
Pretty hand.
We get someone's
Got pretty hand.
Yes. How pretty you want? Until here, half. Yes. Okay. So shall I? Okay.
Yep.
Goodbye. Thank you, Ken and Shu Hui again. See you. Bye-bye.
Thank you, Mr. Ben. All right.
Bye.
Thank you, everyone. Bye.
Thank you, everyone, for joining. Stay tuned, this Thursday.